Migraine is more than just a headache. It's a neurological condition that affects millions of people worldwide. At its core, a migraine is a condition that causes intense, throbbing pain on one or both sides of the head, often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. What makes migraines particularly challenging is that they can last for hours or even days, and they tend to come back over and over again. What's happening in your brain during a migraine is fascinating, but can be quite uncomfortable. Scientists believe migraines involve a wave of electrical activity that spreads across the brain, followed by changes in blood flow. This series of events leads to the release of inflammatory substances around the nerves and blood vessels of the brain, resulting in pain and other symptoms. Studies estimate that about 12% of all the population experience migraines, and it is much more common in women than men. Types of migraine. There are several distinct types, each with unique characteristics. The two main categories are migraine with aura and migraine without aura. Migraine with aura affects about 25% of migraine sufferers. It is a type that comes with warning signs before the headache begins. These aura symptoms often include visual disturbances like seeing flashing lights, zigzag lines, or having blind spots in your vision. Some people experience sensory auras, such as tingling or numbness, that travels gradually from one part of the body to another. On the other hand, migraine without aura is more common and occurs without these warning neurological symptoms. This type skips the warning signs and goes straight into the headache phase. Beyond these main types, there are several other varieties. Chronic migraine is diagnosed when a person experiences headaches on 15 or more days per month, with at least 8 of those headaches being migraines for more than 3 months. Vestibular migraine is another type that causes problems with balance, dizziness, and vertigo. People with this type might feel like the room is spinning or that they are about to fall, and these sensations can happen with or without the classic headache pain. Finally, we have hemiplegic migraine, which is a rare but very serious type. It causes temporary weakness or paralysis on one side of the body, almost like having a stroke. Causes and triggers of migraine. The exact cause of migraines remains somewhat mysterious, but we now know many of its potential causes and triggers. First, migraines tend to run in families, which suggests there is a strong genetic component. If one or both of your parents get migraines, you're more likely to experience them as well. Migraine involves changes in brain chemistry, particularly involving a neurotransmitter called serotonin, which plays a role in pain regulation. During a migraine attack, your serotonin levels drop, which may trigger the trigeminal nerve to release substances called neuropeptides. These substances travel to the brain's outer covering, causing blood vessels to become inflamed and painful. Most migraine sufferers can identify specific triggers that set off their attacks. Stress is perhaps the most common trigger, with many people experiencing migraines during stressful events or, interestingly, right after the stressful period ends in what's called a letdown migraine. Hormonal changes can also play a big role, especially in women. Many women notice that migraines become more frequent or intense during their menstrual cycle, pregnancy, or menopause, all times when hormone levels are shifting, which explains why migraines are 3 times more common in women than men. Certain foods and drinks also frequently trigger migraines. These include aged cheeses, processed foods, food additives like MSG or aspartame, chocolate, alcohol, especially red wine, and caffeine. Environmental factors such as bright or flickering lights, strong smells, and changes in weather or barometric pressure can also trigger attacks in sensitive individuals. Changes in sleep patterns, whether it's getting too much or too little sleep, can also bring on an attack. So it's often not just one thing that causes a migraine, but a combination of factors that build up and eventually tip your body over the edge into an attack. Symptoms of migraine. The experience of a migraine extends far beyond head pain. Many sufferers can recognize the earliest phase of a migraine, called the prodrome, which can occur hours or even days before the headache begins. During this phase, you might notice subtle changes like unusual food cravings, unexplained mood changes ranging from depression to euphoria, uncontrollable yawning, increased urination, fluid retention, or constipation. Recognizing these warning signs can sometimes allow you to take steps to prevent the migraine from progressing. If you experience migraine with aura, the aura typically follows the prodrome. Visual auras are most common and might include seeing sparkling or flashing lights, zigzag lines, or temporary blind spots. Some people experience sensory auras such as tingling or numbness that gradually spreads across the face or down an arm. Less commonly, auras can involve difficulty speaking, confusion, or weakness on one side of the body. The headache phase brings the characteristic pain, typically described as throbbing or pulsating, often starting on one side of the head, but sometimes affecting both sides. The pain typically intensifies with physical activity and can range from moderate to completely incapacitating. During this phase, most sufferers also experience extreme sensitivity to light, photophobia, and sound, phonophobia, with many seeking relief in a dark, quiet room. Nausea affects about 80% of migraine sufferers, with vomiting occurring in about half. Other common symptoms include blurred vision, lightheadedness, and difficulty concentrating. Some people also report unusual sensations like feeling uncomfortably hot or cold, or being bothered by smells that don't typically cause distress. After the headache resolves, many experience the postdrome or migraine hangover phase. During this time, you might feel drained and exhausted, confused or moody, or have lingering sensitivity to light and sound. Some people actually report feeling briefly euphoric during this phase. The entire migraine process, from prodrome to postdrome, can last anywhere from a few hours to several days, significantly impacting quality of life. Diagnosis of migraine. Diagnosing migraines can be challenging as there's no specific test that can definitively confirm them. Instead, your doctor will rely primarily on your medical history, description of symptoms, and the pattern of your headaches. They'll likely ask about the frequency, duration, and intensity of your headaches, as well as associated symptoms and potential triggers. In some cases, your doctor might recommend imaging tests such as an MRI or CT scan. These tests don't diagnose migraines, but help exclude other conditions that could cause similar symptoms, such as brain tumors, strokes, or aneurysms. This is more likely if your headaches have suddenly changed in pattern, if you're over 40 and newly experiencing migraines, or if your headaches are accompanied by unusual or concerning neurological symptoms. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for migraine. Many treatment options exist, and finding the right combination often involves some trial and error. Here are the main treatment options. Number 1. Over-the-counter pain relievers. Medications like ibuprofen, aspirin, and naproxen can reduce inflammation and ease migraine pain. These work best when taken at the very first sign of a migraine, ideally during the prodrome phase. Many migraine sufferers keep these medications handy at all times so they can act quickly when symptoms begin. Number 2. Triptans. When over-the-counter options don't provide relief, triptans can be lifesavers. These prescription medications like sumatriptan, Imitrex, and rizatriptan, Maxalt, work by constricting blood vessels and blocking pain pathways in the brain. They come in pills, nasal sprays, and injections to suit different needs and severity levels. Many migraine sufferers describe triptans as their most reliable rescue medication. The ability to stop a migraine in its tracks within 1 to 2 hours makes these drugs revolutionary for many patients. Number 3. Preventive medications. If your migraines are frequent, occurring more than 4 times monthly, severe, or significantly disrupt your life, daily preventive medications can make a tremendous difference. Beta blockers, including propranolol and metoprolol, were originally developed for heart conditions but work well for migraines. They reduce the effect of stress hormones on your blood vessels and brain, preventing the cascade of events that leads to migraine attacks. Certain antidepressants, particularly amitriptyline and venlafaxine, provide excellent migraine prevention regardless of whether depression is present. They affect the same brain chemicals involved in pain processing and can be taken at lower doses than those used for depression treatment. Number 4. CGRP monoclonal antibodies. The newest revolution in migraine prevention comes from medications specifically designed to block a protein called CGRP that plays a crucial role in migraine pain. Treatments like Aimovig, Ajovy, and Emgality require just a monthly injection and have provided life-changing relief for many who didn't respond to traditional preventives. These targeted therapies often cause fewer side effects than older preventive medications. Number 5. Botox injections. For chronic migraine sufferers, Botox injections administered every 3 months can significantly reduce headache frequency. The treatment involves multiple small injections around the head and neck that block pain signals in nerve endings. Many patients report that their headache days decrease by 50% or more with regular Botox treatments. The procedure takes about 15 minutes and provides 3 months of progressive relief. Number 6. Cold and heat therapy. Applying an ice pack wrapped in a thin cloth to your forehead, temple, or neck can numb the area and reduce inflammation during an attack. The cold constricts blood vessels and slows nerve conduction, directly addressing migraine pain mechanisms. Many sufferers find that 15 to 20 minutes of cold therapy repeated throughout an attack provides significant relief without medication side effects. Some people find that warm compresses work better than cold for their migraines. Heat relaxes tense muscles and improves blood flow, particularly helpful for migraines associated with neck tension. A warm shower directing water onto the neck and shoulders can provide similar relief during an attack. The combination of warmth and gentle massage often reduces pain intensity for many sufferers. Number 7. Dark, quiet environment. Creating a migraine sanctuary by retreating to a darkened, silent room shields you from painful sensory stimulation. Light and sound sensitivity are hallmarks of migraine, and reducing these inputs can significantly decrease pain intensity. Many patients find that even a short period of sensory rest can help their medication work more effectively. Blackout curtains and noise-canceling headphones can create this environment even when total isolation isn't possible. Number 8. Caffeine therapy. A cup of strong coffee or tea can actually help stop some migraines in their tracks by constricting blood vessels and enhancing the effect of pain medications. This is why caffeine is included in many over-the-counter migraine formulations. For those who don't regularly consume caffeine, this approach can be particularly effective at the first sign of an attack. The key is moderation, as caffeine withdrawal can itself trigger migraines in regular consumers. Number 9. Essential oils, peppermint, lavender, or eucalyptus oils applied to the temples or inhaled may provide meaningful relief through their natural anti-inflammatory and calming properties. Peppermint oil creates a cooling sensation that distracts from pain, while lavender helps induce relaxation. A few drops diluted in a carrier oil and gently massaged into the temples or neck can reduce pain intensity for many sufferers without medication side effects. Number 10. Stress management techniques. Since stress is such a common trigger, learning effective coping strategies can dramatically reduce migraine frequency. Techniques like deep breathing, progressive muscle relaxation, and mindfulness meditation activate your body's relaxation response and counteract the stress that often precedes attacks. Even 10 to 15 minutes of daily practice can build resilience against stress-triggered migraines. At the end, remember that migraine management is a journey, so celebrate small improvements and keep refining your approach as you learn what works for your unique situation. Now, we want to hear from you. Have you ever experienced a migraine that completely disrupted your day? What are your go-to remedies that actually help you feel better? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.